Hello guys, welcome back. So one of the most important topic which we'll be discussing today regarding the gastrointestinal system is Hirschsprung disease. Hirschsprung disease. Now what is this Hirschsprung disease? So instead of directly going into the topic, let me start from the basics onwards. So basically in this Hirschsprung disease, one important thing which you need to know is, so during the development of the nervous system, during the development of nervous system, during the embryonal time when the nervous system is developing, nervous system, so how the development basically takes place is that, first of all, a neural plate is formed like this. So this is the neural plate that is basically formed during the development of the nervous system. So this entire thing you call it as a neural plate. Okay, now in this neural plate you have got some different parts. Now what are these different parts are? For example, you see this part here in the neural plate, and as well as the same part here in this neural plate, right? These two red color parts which I have highlighted here in red, this is called as neural crest. This is called as neural crest. Okay, and next, this green color part here which is located laterally to neural crest, this green part which is located lateral to neural crest, you call it as ectoderm. Okay, now below here, down exactly below the neural plate, you have got this round opening. This is called as notochord. Now in the later on stages of development, what will happen is, you see a small depression over here, right? You can see a small depression over here, right? So in the later on stage, what will happen is, this depression increases in depth. So this depression furthermore increases in depth. Now when it furthermore increases, how does the picture look? This is how the picture looks, right? So this entire thing is again your neural plate. This entire thing is again your neural plate over here. So this is your neural plate, right? And as I already told you, neural plate has got what? This part here, this is called as neural crest, and the remaining part, this is called as your ectoderm. So this entire thing is called as your ectoderm, right? And now this depression in the center here, this depression, you call it as neural fold. Okay, now what will happen is, this fold here further increases deep, right? This fold, it further increases in depth. Now when this fold further increases in depth, what will be formed? Now look here, you see the fold has further increased in depth over here, right? So this fold has further increased in depth like this, and finally the neural fold, this neural fold which was increasing in depth, has further transformed into this part. This is called as neural groove. So this is called as a groove and this is called as a fold. The things remain same. What are the things? As I already told you, I told you that here, okay, let me mark it with markers. So here I told you, you have got what? Neural crest, right? So this is called as your neural crest cells, and the green ones is called as a neural plate, right? So this entire thing is your neural plate over here. Now in the later on stages what will happen is, see this part of the neural plate, this part which I'm highlighting now, look here, this part of the neural plate and this part of the neural plate, they both of them come together and join. Now when the both of them come together and join, what will happen is this entire neural plate transforms into a single circle, right? So let me draw it and explain so that it would be easy for you. But one thing you need to remember is these two parts here, these two edges of the neural plate, they come towards each other and they join, right? So how does the picture look when it joins? Look here now. So when these two edges come together and join, and now look here now. Now what has exactly happened here? What has exactly happened? I hope you can figure it out what has happened here. See, the thing is, these two edges, these two blue color edges which I have already mentioned here, these two edges, they came near to each other and they join. So when these two edges they join together, what will happen? That will result in the formation of a circle, right? So of course when the edges join together, what will happen? Now let me make a picture of it and let me explain you very clearly. I'm sure some of you have already figured it out. Look here now. When these two edges join, what is going to happen? First thing is, look here now. When these two edges join, they become like this, right? And that's what I drew here, the circle. And next, what is the fate of this neural plate here? This neural plate, it becomes as a single plate like this. The same thing I've drawn here, right? The same thing, the same thing I have mentioned here. Now, exactly what is going to happen is that, look here now, this is the most important thing which you really need to catch. The most important thing is here, these neural, let me put the picture back. Yeah, so this is the entire picture, right? This is the entire picture. Now what will happen is, when these two edges join together and form a circle, finally what happens is this neural plate gets separated from this neural tube. Now this entire circle here, you call it as neural tube, right? This is called as neural tube. And next what happens is, these red color things which I have mentioned here, these red color things which I have mentioned here, what do you call these red color things? These red color things, you call them as neural crest cells. What will happen is, these neural crest cells which were here previously, right, here, right? So these neural crest cells, what will happen is, they will fall off. These neural crest, they will fall off like this from both the sides, right? So all these neural crest cells, they will fall off. I mean, not in this stage, obviously in this stage, but I'm just drawing it to mention it, that all these neural crest cells, they fall off like this. So when the neural crest cells will fall off, will there be any neural crest cells here? No, there won't be any neural crest cells in the neural plate. So what all the neural plate is having is only this green color thing. What is this green color thing? This green color thing you call it as ectoderm. So when the neural crest cells fall off, the only thing that is left in the plate is completely your ectoderm. So this entire thing is your ectoderm. So this is the only thing that is left. When it is left, the only thing that is left is ectoderm, and this ectoderm is formed. How is this ectoderm formed? ectoderm, the entire neural plate is occupied by this ectoderm. How is this entire neural plate occupied by this ectoderm? It is completely occupied by the ectoderm because of the migration of the neural crest cells. Now finally the neural crest cells have come here. Now what is the fate of why these neural crest cells are so important? Why these neural crest cells are so important is these neural crest cells, some of them, they slowly migrate. Okay, slowly they migrate, and they form your, what is this? They form your smooth muscle. Some of these neural crest cells form your smooth muscle. Okay, some of them form your smooth muscle. Not only smooth muscle, even neural crest cells, they migrate to distant places in our body, and finally they form some special structures called as osteoblast and osteoblast and chondroblast. I hope you know what is osteoblast and chondroblast, right? Next, these neural crest cells, they also migrate everywhere like this, I mean to distant places, and these neural crest cells also form another special structures called as adipocytes. So in this way the neural crest cells, they form different things. For example, as I already told you, it forms what? Smooth muscle, which I've already mentioned here. It also forms what? Osteoblast. It forms chondroblast, right? It also forms what? It also forms adipocytes. Not only adipocytes, it also forms melanocytes, right? It also forms your melanocytes. And another thing is, it forms your odontoblasts as well. In your teeth. Odontoblasts are located in your teeth, right? And one important thing, it also forms your neurons. It means the nervous system. It is forming the structural and functional unit of the nervous system, that is the neurons, right? And another most important thing which is really needed for our topic is the neural crest cells not only form all these things, but the neural crest cells, let me write it here separately, the neural crest cells, they form the nervous system of your gut, right? They form the nervous system of your gut. What do I mean by that is, for example, let us take an example like this is your ectoderm, right, which I already mentioned. So this entire thing is your ectoderm. Secondly, this is your neural tube over here, nice. And thirdly, here you have got your neural crest cells on either sides, right? Because neural crest cells are found or fall off or migrate from either side, which we already seen before. So these neural crest cells, what will happen is, look here now, these neural crest cells, what will happen is, for example, let's say that this is your esophagus, this is your stomach, this is your duodenum, which has 4 parts, and here you have got your jejunum, ileum. I'm drawing the ileum short because I don't want to make the diagram look big. And here you have the cecum, and here comes your ascending colon, here comes your transverse colon, here comes your descending colon, sigmoid, colon, rectum and anus, right? So this is a simple picture of your intestine. Now what happens is these neural crest cells, they migrate slowly like this and they enter into your entire intestine. Now in the intestine you already know that you have got what? In the intestine you have got what? You have got layers. There are basically 4 layers in the intestine. For example, if I cut this part of the intestine and I put it here, right? What is the innermost layer? See, this is the innermost layer of the intestine. On either sides, this pink one is the innermost layer of the intestine. This innermost layer of the intestine is called as mucosa. Okay, so this entire thing over here, this is your mucosa. Right. After this mucosa, the next thing is this one, the green color layer. I'm sorry. The next thing is the green color layer. Of course, this is called as submucosa because it is below the mucosa, right? So this is called as your submucosal layer. So the innermost layer of your intestine is called as mucosa. Of course, there are totally 7 layers. I mean, mucosa is further divided into lamina propria, right, and all, but which is not necessary for us to discuss now. They're already recorded in my previous lectures, but for now what you need to know is the innermost layer is mucosa. Next, the green color layer is submucosa, and after that you have got this layer here, red color layer. This red color layer is called as muscularis mucosa. Why? Because it has got muscle in it. So when you activate the muscle, what will happen? It will perform a action called as peristalsis for your intestine so that the food can propel down. Now look here, this is your gut, right? And what is the outermost layer? Outermost layer is serosa or adventitia, right? So what was the second layer here? This layer here, the second layer is called as submucosa, and the red one is called as muscularis mucosa, right? Submucosa, or so not muscularis mucosa, it is muscularis propria. And the last layer here called as serosa or adventitia. Now basically, even in your intestine also there is nervous supply. Of course, only when there is nervous supply the muscles will contract and therefore there will be peristalsis of the intestine. You know it already. Now what are the different types of nerves that are supplying to your intestine? There are 2 important nerve plexus that are supplying to your intestine. Now look here, one important nerve plexus, let me highlight it with the black. One important nerve plexus is called as Meissner's plexus. And where is this Meissner's plexus located? Look here. You see, I'm drawing the nervous plexus over here, the plexus of the nervous system of your intestine. And in which layer am I drawing it? I'm drawing it in the submucosal layer. So it means submucosal layer has got a specific type of nervous system which is named Meissner's plexus. This is called as Meissner's plexus. Second thing is, there is the second different type of nervous system in your intestine. The second different one type is Meissner's plexus and the second type is called as Auerbach's plexus. And where is this Auerbach's plexus located? Where is this Auerbach's plexus located is, so this layer here is called as muscularis propria, right? This red color layer is called as muscularis propria, which has got circular muscles and longitudinal muscles. Now let me draw a little bit about this muscularis propria here. Look here now. it has got like this muscles inside. These muscles inside are called as circular muscles, and the muscles outside like this are called as longitudinal muscles. So this two layers of muscle together you call it as muscularis propria, where inner layer is circular and outer layer is longitudinal, right? In between both of them, you have got another nerve plexus which is very tough and very powerful, because it has to activate the circular and longitudinal muscles. So this nerve plexus over here, this is called as Oribax plexus. So from today, if someone asks you what are the two different nervous systems, or what are the two different nerve plexuses that are located in your intestine, if someone asks you what are the two different nerve plexus that are located in the intestine which are responsible for the contraction and peristalsis of the intestine, so there are two. One is called as Meissner's plexus, another one is called as Oribax plexus. And if someone asks you where are they located, tell them that Meissner's plexus is located in submucosa and Oribax is located in the muscularis layer or muscularis propria layer, right? So this is, no, why I'm telling all of this is, who is forming this Meissner's plexus and Oribax plexus in the intestine? Which cells are forming this Oribax plexus and Meissner's plexus in the intestine? The Oribax and the Meissner's plexus in the intestine are formed by these neural crest cells. So these neural crests, they migrate all the way down into the intestine. So as they are migrating down along their way, what happens is slowly they form the Meissner's and the Oribax in this way. You see? So they form the Meissner's and the Oribax. So in the first week, some of the see, this is a neural crest cell. Some of the neural crest cell migrate down in the first week and they form Meissner's as well as Oribax. Again, after some days, in the second week, again some of the cells come down like this and they form Oribax as well as Meissner's. So just think the pink one might be Oribax and the red one is Meissner's. So in the third week, so in the same way, the entire intestine is formed. The entire enteric nervous system is formed like this, right? The entire enteric nervous system is formed like this by Oribax plexus, and the entire enteric nervous system is consisting of Oribax and Meissner's plexus, and it is formed by the neural crest cells. Now look here. In the sixth week, what happens is, slowly the neural crest cells, they start entering into the colon. So these red ones which I'm drawing are the neural crest cells which are entering into the colon. And what happens is, even in the colon also they start forming the Oribax, and the pink ones is Meissner's plexus. Okay. Now in the total 6th, 7th week, what happens is the entire ascending colon, in the total 6th and 7th week, what these neural crest cells do is they form the enteric nervous system of the entire ascending colon. Now by the time it comes to 7th or 8th week, it is a time for the transverse colon to completely fully get loaded with the enteric nervous system, that is the Meissner's and the Oribax plexus. But look here, suddenly when it comes to the 7th, 8th week, this doesn't happen in everyone, it happens only in few of them, right? So suddenly when it comes to 7th, 8th week, what will happen is the neural crest cells, they stop migrating. These neural crest cells which were here, which were previously getting migrated into your intestine, they stop migrating. So when they stop migrating in the 7th, 8th week, basically the transverse colon and the transverse and the descending colon should be completely loaded with the enteric nervous system. So as they have stopped migrating in the 7th 8th week, the transverse and the descending colon cannot be loaded with the nervous system. So when there are no neural crest cells, then there is no enteric nervous system. So when there is no enteric nervous system, of course there is no orbax and Meissner's plexus in the transverse colon as well as in the descending colon. So when such presentation is given, what will happen? Will there be any contraction of the transverse colon? Will there be any peristalsis of the transverse colon? No. So there will be no contraction or peristalsis of transverse colon and the descending colon. But till the ascending colon everything is fine. But when it comes to the transverse and descending colon, as there is no nervous system, so there is no peristalsis. Now when there is no peristalsis, what has happened? Tell me. When there is no peristalsis, what will happen? Look here, you take the food. So this is the food. As there is nervous system here, the food will enter into your intestine. It will enter into your jejunum. The food later on it enters into your ileum, right? The food, I mean, after digestion, as the process is going on, the digestion happens. So even it enters into your cecum, ascending colon, the food even enters into your transverse colon. But now the food is in the transverse colon. Can it further pass forward? No, because there is no peristalsis. So as a result, the food cannot be propelled forward. So the food will stay here. Right? So the food will stay here. Finally, what will happen is, second time when the patient eats the food, so there is little more food that is getting added up here. Third time when it takes, there is little more food that is getting added up here. Right? So when the food is keeping on getting added up, what is happening? Can the patient, of course, this problem happens in the neonates, right? 7th to 8th week during the development. Now immediately after the birth, what should happen is the baby or the neonate immediately after the birth should pass the first stool. The first stool which the baby passes is called as meconium. The name of the first stool which the baby passes or the neonate passes is the meconium. Now during the embryological development, during the formation of the nervous system in the intestine, in the 7th 8th week, the transverse colon and the descending colon are not loaded with the nerve cells or are not loaded with the nervous system. So as a result, immediately after the birth, can the baby pass the meconium? No. So if mother complains that, doctor, my baby on the second day, I have noticed that my baby didn't pass the first stool, meconium, then you need to suspect of Hirschsprung disease. Okay. Not only that, the first thing is failure to pass meconium, and the second thing is, look here, second thing what happens is, slowly when the neonate eats the food, when you feed the neonate for the third, fourth, fifth, sixth, seventh time, what will happen is the additional food gets on accumulating in the transverse colon, and at time it might happen like this, that the transverse colon, right, at times it might happen like this, that the transverse colon might distend like this, because now the transverse colon is completely having a lot of food, right? So when the transverse colon is completely having a lot of food, what will happen? The transverse colon will obviously distend. So this is the entire transverse colon having food. So can I call it as a megacolon? Right? You see, a lot of food which cannot pass. Why it cannot pass? You know the reason. Right? So the second important thing which I'll find in the patient, or the second important thing which the mother will complain, is that, doctor, there is on the second day on the second day for my neonate, for my child, I have found abdominal distension. I have found abdominal distension. And not only abdominal distension, doctor, I have also noticed that my baby, he didn't pass the first stool, that is meconium. Right? And next important thing is, third important thing is, what the mother will complain is that she'll tell that my baby is having vomiting, a lot of vomiting. You call it as bilious vomiting. Right? Bilious vomiting. Now, why there is vomiting in the baby? Why there is vomiting is, see, there is abdominal distension. Before you take to the hospital, of course, you feed the baby, right? You don't know that the abdominal distension is developing. You don't know that the baby hasn't passed the meconium. But when you are keeping on feeding the baby, as the food cannot further go forward because of this large obstruction, what will happen is the food tend to go back. So when the food tend to go back all the way like this, you see, the food tend to go back all the way like this. Of course, the baby will vomit the food out, which will lead to vomiting. Okay. The next thing is, as baby cannot pass the stools, you call it as constipation. You call it as constipation. So overall, if we write down everything in detail, so this is all the explanation I've given. Now what I'm going to write is very important for you, so just note it down. Of course, the same things which we already discussed. The same things is, first thing is it a problem that is acquired or congenital? It is a congenital problem. So it is congenital problem. And moreover, in this congenital problem, what is the end result? The end result is the size of the colon is increased, which we already called it as megacolon. So I can call it as congenital megacolon. So if I ask you what is a pathogenesis, if I ask you what is a pathogenesis, how is the disease developed? Now you tell me, how is the disease developed? I already told you that during the 7th, 8th week, there will be absence or fail. Yeah, what is the prime problem? The prime problem is absence of enteric nervous plexus. Where? In the intestine. In the intestine. Why did the enteric nervous system didn't form? Because of the failure of the crest cells. What crest cells? The neural crest cells to migrate. Failure of the neural crest cells to migrate. Okay. Another important thing is symptoms. Right? Now what are the symptoms? Of course, I told you the first thing will be vomiting. Why vomiting? Because the food cannot go further forward, so obviously it will be going in a retrograde fashion, resulting in vomiting. Next, failure to pass meconium in the first 48 hours of life. In the first 48 hours of life, the stool has to be passed. And third thing is constipation. Right? Constipation. And another important thing is it a small bowel obstruction or large bowel obstruction? It is an obstruction which is seen in the large intestine, so you call it as large bowel obstruction. Right? Large bowel obstruction. Now on the physical examination, what do you see? I mean, you, with these complaints, you bring the patient to the doctor. Now when you bring the patient to the doctor, of course, what will the doctor notice? The first thing the doctor notices is that there is abdominal distension. Abdominal distension. And second thing he notices is that there is no stool. Right? So what you basically do is, look here, what I will do is, you take a biopsy, right? You put an instrument. Now focus on this picture here. Now I'm removing this picture from here. Look here now. Now what you do is, as a doctor, look here now. This thing, as you know, that okay, look here now. What you have to do is, you have to take a biopsy. Now to take a biopsy, right, what will I do? For example, let us think that, see, this is the rectum. This is the rectum. Okay, now if this is the rectum, what you do, you put the instrument into the rectum. Now you put the instrument into the rectum and you take a piece of the tissue from the rectum. Now which layer will you choose? Will you take the mucosa layer? No, because normally mucosa layer doesn't contain any kind of nervous system. So even if you take a mucosa layer in a normal person, or even if you take a biopsy of mucosa layer from the person with Hirschsprung disease, you won't find anything. So what you need to do is, you better have to snap a piece of submucosa layer, because normally submucosa layer has what? Submucosa layer has Meissner's plexus. But in these patients, there will be no formation of Meissner's plexus and Auerbach's plexus, so no need to go till the muscle layer. Even if you go till the submucosa layer, you can very easily find the answer, right? So in the submucosa layer, you take the rectal biopsy, right? You call it as rectal suctional biopsy. So when you take the rectal suctional biopsy, what do you find in the submucosa of submucosa? Submucosa, what do you find? You find there is absence of ganglionic cells. It means the nervous system, right? So additionally, what all investigations you can do? Additionally, what I'll do for this patient is, I'll do an imaging. Imaging in the sense the X-ray, the plain abdominal imaging. So when I do the plain abdominal imaging, I can find whether the bowel loops are extended or distended or not. You call it as plain abdominal X-ray or radiograph. So let me show you a picture of plain abdominal X-ray or radiograph. Look here, this is the plain abdominal X-ray. Look here, look at the bowel loops. You see the bowel loops here. So there is a lot of food in there. The bowel is having a lot of food. You see, it is because of this obstruction how they have been distended, and there is a lot of food in there which has been obstructed. As a result, there is distension of the bowel, right? So this is all the diagnosis and the uh, symptomatic part. So what is the treatment you give? Are there any drugs? No, there are no drugs. There is only one thing, that is surgical resection of the bowel, because you cannot put any type of nervous system or impregnate any type of nervous system into the intestine, right? It is not a pacemaker to easily implant it. So it is a nervous system, so you cannot do it. Instead you remove it. Okay, so if you talk about the prognosis, of course after the surgical resection the prognosis is very good, and the mortality is less than 1%, and the patients will have the normal quality of life, right? Normal quality of life. And I wanted to discuss one most important complication here. One most important complication is, if you're not really making a surgery or treating the patient as early as possible, the bowel will distend so much that there will be rupture of the bowel and the patient will die. This is the one most important complication which you need to know. And another important thing is, the questions regarding this I'll be posting it down in another separate file, right? Or in the If you're watching it from the YouTube, so in the description box below you will be having the questions, and find out